on today's show, Love That Heart of Yours. We've assembled the best of the best from the Cleveland Clinic to share life-saving cardiac care information.
And we'll hear from some amazing patients, even one you watched on TV for many years. And of course, our own Dr. Mark is here for it all. New Day Cleveland starts right now. Welcome to New Day Cleveland, Love Your Heart. And we call him Dr. Mark, but he's really known as Dr. Mark Gillenoff, world-renowned Cleveland Clinic heart surgeon. How does that sound?
It's always amazing to have him here in studio with us. And Dr. Mark, one of the main things you say to us every single time you're on is know your numbers. And that is no exception for today, right?
Not your phone number.
You should know your phone number as well. But your phone number generally won't save your life. These numbers that you should know will save your life. And what are they? Your blood pressure. My wife Lisa takes hers every day. That's a great idea in a quiet room. And know that your blood pressure is good. What's good? 120/80. That's a good blood pressure. Another good number to know is your cholesterol, but not just your whole cholesterol. You want your LDL cholesterol. The LDL is the so-called bad cholesterol. And you want that number under 100. And then a number you can find out right now at home is your BMI. And this is just an index of your weight and your height, and you want that 25 or less.
That's a scary one.
It is, and you know, I feel like the numbers have changed over time. They've lessened. I mean, I know that LDL, it used to be a little higher. Now they're down to 100. So it's always good to stay on top of what the numbers are too, because you might think from 20 years ago that you knew what your numbers should be, but they might be different now.
Yes, as we develop more data, we find that some numbers are better than others. It used to be blood pressure of 130 was thought that's pretty good. Actually, that's not so good. 120/80. Is better. So we will tell you every year, probably every episode, what are the numbers you should be shooting for.
Do stress and blood pressure sort of relate to each other?
They do in the sense that excess stress can cause high blood pressure, but stress alone and high blood pressure alone can both cause heart disease and can both contribute to the risk of heart attack and stroke. So either one of them unfavorable, and they can go together and be doubly unfavorable.
Well, the thing is, too, I know a lot of people realize stress can really negatively impact you, but there are other factors that you'd be surprised that people don't realize impact their heart negatively.
There are. We do this survey every year. We survey 1,000 adults in the U.S., 1,000 random people, and we ask them various questions. And this year, one of the questions was, here's a list of factors. Do you think they affect heart health? And some of the results were just shocking. Smoking was on the list.
They didn't realize.
41% of people or thereabouts did not realize that smoking is bad for your heart, that excess alcohol is bad for your heart, lack of sleep.
The sleep one is a big surprise.
That's huge. Lack of sleep is huge when it comes to overall health. And I think a lot of people take that one for granted.
Yeah. Lack of sleep increases blood pressure, increases your risk of heart disease and stroke, can be associated also with sleep apnea, et cetera. And people ask, well, how much sleep is the right amount? And that's going to vary person to person, but 6 hours minimum, really shooting for 7-ish, maybe 8 is best.
Can you sleep too much?
Yeah, you also can sleep too much. So it's a little bit like weight. Being super thin or super heavy is bad. And sleeping way too much, people are 14, 15 hours, that can be associated with obesity, diabetes, being sedentary, less exercise, and sleeping way too little, also unfavorable. So shooting for a sweet spot of around 7 hours is a good target.
What about medications? Do people feel like that's something they want to take? Do you find that people are afraid to take it? Do they feel like, oh, I should wait, this is the last resort to take the medicine?
Sort of an interesting paradox here. People don't mind taking supplements. They love supplements. Supplements somehow feel holistic and natural. You know, there's that whole counter.
I'm one of them. I get it. I'm like that.
They're packaged in green and in purple bottles,
Full
so
of
they look
promise.
attractive.
Yeah.
So people love supplements, But if you give them a real prescription medicine, which comes in a less attractive container and sounds more serious, they say, no, can't I take a supplement? And the answer is prescription medicines are proven to do what we say they do. They're regulated by the FDA and they are safe. Supplements, a lot of fuzziness there. They may or may not contain exactly what they say. They sometimes help, they sometimes hurt. Boy.
Like the medicine man on the back of a wagon.
You just,
Yeah.
Well, and I think with heart health and any kind of health, there's no one size fits all. I know Dr. Cho, who we're going to be speaking with a little later, she suggested me to take Metamucil to help with my LDL number. It helped to work for me. So I think there's a lot of different things that you just have to consult with your doctors to figure out what is the best plan for you.
Yeah, it's going to vary person to person. And Metamucil, I don't think of as a supplement. That is an actual medicine that not only improves digestive health, but captures cholesterol and lowers your LDL. So that one's proven.
So, well, there we go. And that's why it worked for me.
Yeah.
We'll chat with her in a moment. Dr. Mark, thank you. We're going to be sticking around with more of your answers and questions to things.
Sure.
Your answers to questions, I should say, in a moment. First, though, it was almost 2 years ago that she didn't realize she was having a heart attack. Today, she is skiing with her family, and I was so blessed to have the opportunity to talk with longtime Cleveland television personality Jan Jones about her journey. So you're out there in Big Sky, Montana right now, healthy, skiing away, but take me back to that spring day in 2023 when life changed.
It was really amazing because I felt terrific. I've been active and busy, no indication of anything wrong, a healthy woman. And I had a lot of responsibilities coming up and a lot of deadlines. And I was up till 1 a.m, which is my usual MO. When I woke up early the next day, however, I had a sore throat and I thought that I was going to end up being sick, lose a day, get behind. And I was a little concerned when I got up to take a lozenge, I started to dry heave. Well, it didn't go away and it got worse. And it's when I realized that the dry heaving wasn't coming from my stomach. So it wasn't a stomach bug. It was coming from my chest.
Jan attributes what happened next to her involvement with the American Heart Association and hearing about symptoms.
I have to tell you, it clicked. It was like a light going off. Women's heart attacks don't present like the normal thing you expect. And that's when I knew I needed to get to the ER.
And you had the widowmaker. The main artery that's pumping the largest part of your heart was
Yes.
completely blocked.
When I got there and they did the EKG, they immediately rolled me into the operating room. And I remember Dr. Sharfstein saying to me, "You are having a heart attack." And I looked at him and I said, "Wait a minute." Even at that last moment,
It didn't register. Yeah.
And he said, no, every minute counts. Let's go. Had me on the table in my street clothes. And when I woke up, I felt great again. So I felt terrific the day before. I felt terrific the day after. And I remember saying, "Do I need to worry about other arteries?" And he said, "No, you have no clogged arteries. Your numbers are great. You're healthy. You're strong. There's no reason in the world for someone as healthy as you to walk in and have a widowmaker heart attack, except you can't outrun genetics."
Jan's father suffered a heart attack in his 60s.
The staggering statistic is that 45% of women over 20 are living with some form of cardiovascular disease. And that is alarming. So what advice would you give to other women?
And if I may say, women die of heart disease, more women die of heart disease than all the cancers combined. So it's prevalent. It's there every day. And we don't think about it. It's kind of a silent killer. So what I say is, whenever you feel a little off or you know that something is wrong and you're not sure what it is, don't blow it off. Don't say, "Oh, well, I'll take a nap," or "It'll go away," or "I'll see my doctor next week." No, take care of it right now.
I know you're out in Montana, you're skiing, you have your beautiful daughters, Megan and Jill, and your granddaughter, Haley, there. I know, are they there? I would love to bring them in because
They're hanging.
When
hanging
something
with
like
me.
this happens, it not only affects you, it affects your whole family. It also probably affects, ladies, how you handle your own lives. How has this changed your lives?
Well, we're the ones that are always telling mom that she needs to step back, slow down, learn to say no. And, that was a lesson she needed to learn. This is a woman having a heart attack who drove herself to the ER and drove around looking for a parking spot before she went in. because you don't want to bother anybody, right? Mwah.
That's exactly what I would say too, is that stress is a silent killer, and
So
it's not
true.
always about your physical health, it's also about your mental health and the load that you put on yourself, and that is way more important than I think anyone knows. So
Good
slow
balance.
down.
She's learning good balance.
Megan?
And I'm sure you're learning from her as well, Megan, right?
I would say that the best lesson that Janice taught our entire family is maintaining a positive attitude all the time.
And her experience is going to help you to live stronger, better lives as well. So in that sense, feel like she's saving your life too. It is such a pleasure. Jan
And
has been a light in Cleveland for decades. It is so good to see you thriving. I'm going to let you go back and hit those slopes.
A sweet lady indeed. Okay, there's a lot more to know about how heart disease affects women. Well, Nicole is at the Cleveland Clinic for more.
That's right. Good morning, David. So heart disease is the leading cause of death for both men and women. And while family history does play a role, it really is just a small part of that story. Dr. Leslie Cho is a cardiologist here at the Cleveland Clinic. Thank you so much for inviting us out this morning.
Oh, thank you for having me.
So we're talking about heart health, specifically heart health with women. And we talk about genetics, we talk about family history, but really that's just a small portion of things that we can't control. There are other things we can control.
Absolutely. 90% of heart disease is controllable. And regardless of who our mom and dad are, regardless of the genetic history, you can control heart disease. And by controlling high blood pressure, cholesterol, diabetes, weight, and never smoking, you can really lower your risk.
All right, so no smoking, limit the alcohol intake, introduce exercise to your routine. I want to talk specifically about heart attack symptoms because we commonly hear about chest pain, especially when it comes to men who experience heart attacks. But with women, those symptoms can be very different.
You're absolutely right. I mean, we often consider chest pressure, chest tightness. You know, we say pain, but it's really not pain. It's pressure and tightness.
Okay.
Women have it too, but they are more likely to have atypical symptoms. So women will have shortness of breath, they'll have extreme fatigue. Some women will just have sort of profound sweating, jaw pain, arm pain that radiates down. Some people have back pain, so they have these sort of atypical symptoms.
You know, I think when it comes to women in particular, we're so worried sometimes about our life in the workplace, our lives at home, taking care of kids, grandchildren, that we tend to put our health at the bottom of the list. But it's so important to put your health at the top.
Yeah, you know how they tell you it in the plane, like, put the mask on yourself and then put it on your child? I mean, that's really true. If you are sick, you can't take care of your children, your parents, your spouse. So it's really important to take care of your heart.
And one of the ways you can do that is by setting up an appointment to see a cardiologist. At what point should you make that first appointment? And when you do finally go in for that visit, what can you expect?
So most women, you know, go see their gynecologist all throughout their life. And then they see a doctor when they are in menopause. But ideally, you should be getting your yearly cholesterol check, yearly blood pressure check, making sure you're not diabetic. And you can do that with your family practice doctor or your general internist. Now, some women come to see a cardiologist because they're having symptoms, chest pressure, chest tightness, shortness of breath, or they have palpitation. When you come to see a cardiologist, the number one thing we're going to do is go over your risk factors and then listen to your story. It's really important in the era of Dr. Google to let somebody be your doctor instead of being your own doctor. Oftentimes, you know, there was a really fascinating study. Women who've had heart attack, you know, men called 911 or went to the emergency room. Women called their family. Their family first, which is like astounding. So even in 2025, women are showing up to the emergency room later because they're like, well, maybe it's not my heart. I hope it's not my heart. And they're wishing it away.
Right. Now, something else I want to talk about before we run out of time. We tend to think that we need to see a cardiologist later in age, but sometimes people who go through pregnancy, they experience certain conditions that can have an effect on their heart health later in life.
Absolutely right, 100%. So having had high blood pressure during pregnancy, even if it's not preeclampsia, just having high blood pressure during pregnancy, gestational diabetes, early delivery, or premature menopause can greatly increase your risk. So if you've had hypertension during pregnancy or even after you delivered, it increases your risk for having heart disease by 300%.
Wow.
I know, so it's really important. This doesn't mean you're going to get it.
Sure.
It just means you have to be super proactive.
So I think, Dr. Cho, the biggest takeaway, be your biggest advocate.
Yes.
And obviously, if something feels a little bit off, don't wait, don't delay, don't talk to your friends. Make that phone call to see your cardiologist. Dr. Cho, thank you so much. You can also log online to their website, make your appointment today. And David, the biggest thing, if something feels a little bit off, listen to those warning signs and make that call today.
That's right. Do something about it. Some great information there. And of course, you may have more questions and answers at this point. So what do? You send them to newday@fox8.com, and Dr. Mark will answer them later in the show. Coming up on New Day Cleveland, love your heart. Things in your genes that affect your heart health, including a specific test you may need to ask your doctor about. A genetic disorder discovered in a college student allows him to save many family members. Here's Dr. Mark.
You could say that Thomas Daniel's nephew saved his life.
My nephew got sick, had a dissection, and had to be taken to the hospital. He almost passed.
An aortic dissection, which is often fatal. Afterwards, genetic testing revealed the cause, Loeys-Dietz syndrome.
So his parents, my brother, had to be tested, and my brother was positive. So the genetic counselor says to my brother, well, you need to have all your siblings tested. And there's 5 of us all together. So eventually all 5 of us got tested. 4 of us were positive.
Positive for Loeys-Dietz, then Daniels received another blow.
My big shock is when he told me that I had an aneurysm and I needed to get it taken care of pretty much right away. So, I mean, that was a shock. That was a big shock for me.
The Loeys-Dietz syndrome is an inherited disorder, and basically it's a mutation in a person's genes, and it results in a weakness of the structural components of the body.
Dr. Lars Svensson operated on Daniels. He's been studying Loeys-Dietz syndrome and the similar Marfan syndrome since the 1980s.
I saw some patients that clearly did not have Marfan's, but there was something going on. They had some features of Marfan's, but they didn't meet the criteria for Marfan's. At that time it was called the Ghent criteria for Marfan's. So they had similarities, but not as strong. A lot of them had aortic dissection. And now in retrospect, a lot of those patients were actually Loeys-Dietz patients. It's just we didn't have the genetic testing to do it.
The surgery wasn't bad. It was recovery. Just, you know, I'm a workaholic, so I had to slow down. I actually went 12 straight weeks without going into my pizza shop. My wife, she helped out a lot, and then I have some good employees. So, like I said, we paid the bills from home and stuff. Mm-hmm. But I had 3 weeks to get the shop ready because I went from the cardiologist saying I needed surgery to almost 3 weeks till I had to have the surgery. So that was a frantic 3 weeks getting everybody in order. I have some good employees.
Unfortunately, Loeys-Dietz syndrome isn't ending with Daniels and his siblings.
Once I became positive, my 2 daughters needed to be tested. One was positive, one was not. So actually, the 4 siblings were all positive. We each have 1 child that is positive.
Daniel's daughter is regularly examined by her cardiologist and so far is doing great.
I am pro genetic testing for obvious reasons here. It's just, not only you're doing it for yourself, it's also for your future family and your family, your past family, and everybody that's right beside you. I think it's great. I honestly do.
Okay, well, it's not a surprise that heart disease runs in families. Knowing the specific types can really save lives. So Dr. Mark's going to help us with that. Genetic disorders that affect the heart. And it makes a lot of sense. I mean, you receive a lot of things from your elders, and you get genetics too.
Yeah, you get eye color, you get height.
Hair?
You get hair or less hair sometimes. We both have a lot of hair. We're in good shape there. Yep. But you can also inherit tendencies to develop cardiovascular or heart problems. And it's really important to know your family history because your family history isn't necessarily your destiny. You've got some control, but it gives you an idea of what is my risk? What's my personal risk and what can I do about it? Because there are a lot of things you can do about it.
It just seems so simple. It's such a giant indicator that you would just do that, but I imagine you don't think about that. And I guess something that could remind you something like that is something like arrhythmia.
Yeah, if you've got a family history, say, of atrial fibrillation, of more serious arrhythmias like ventricular tachycardia, these can run in families and you'd want to be tested. There are conditions called cardiomyopathies. That means a disease of the heart muscle. Some of these are inherited, many treatable, heart failure, vascular disease, meaning atherosclerosis, hardening of the arteries, arteriosclerosis. Those all mean the same thing, plaque buildup within arteries. And most people are going to get some of that plaque buildup as they age. But if you've got a mom or a dad or a family member who got this kind of plaque buildup in his or her 30s or 40s or even 50s, that's a significant piece of family history.
I knew a young lady a bunch of years ago. She was only 30-something, and she had to have a bypass surgery, which back then it was a dangerous kind of thing to do. She had it, and she ended up okay. She's on medication, but then her son, in his 20s, they discovered it in him because they did an investigation, like you're talking about.
And now we've got treatments so that her son may not necessarily ever need heart surgery.
He could have avoided it.
Yeah, exactly. But if you've got a family history that's very strong, you need to be tested. No serious testing, all non-invasive stuff to find out what is your risk. And if you know your risk, you can change your risk. There's so many things you can control.
And we talked about so many things about diet, exercise, sleep, smoking, alcohol, and all that. How big a portion is something being inherited like this to the heart health?
In general, 90% of your heart risk is not inherited, meaning 90% is controllable and 10% is inherited. There are a few conditions, like the woman whose son got this. That's a little bit different. That's probably something called familial hypercholesterolemia. But for the rest of us who don't have a very specific gene, 90% is under your control. Don't smoke, exercise, eat well.
I know we never have enough time for all this, but lipoprotein, how does that play into this?
There's great interest now in this new molecule. It's not a new molecule, newly recognized molecule
We
as
just
being
found
important. Yeah, lipoprotein little a, capital L, little p, little a. And it is, you can think of it as a type of cholesterol-like substance, and an elevated level of lipoprotein little a is associated with heart disease. Should you get yourself tested for this? Yes, if you have one of these conditions on the screen, a family history of heart disease, particularly if it's early, high LDL cholesterol, lots of heart events in you personally, or if you've got a family member who's been tested, and you only need to be tested once. I actually got tested for it, I'm okay. 20% of all people have an elevation of this particular molecule, and it's just one of those things you'd like to know.
It's the easiest way to do it. I mean, we talked about all the difficult things to do, losing weight and all the changing your habits, this sort of thing. This is a no-brainer. It could help a lot of people.
Exactly.
Great. Okay, folks, coming up next, how safe is it to exercise in the winter? Well, a sports cardiologist shares her advice, and later, foods that lower your blood pressure and cholesterol. That's all coming up on New Day Cleveland. Love your heart.
Welcome back to our Heart Show. Exercising outdoors in the wintertime. What do you think about it? Is it safe? What is not safe to be doing? Well, Dr. Tamana Singh is joining us. She's the co-director of Cleveland Clinic's Sports Cardiology Center. She also happens to be a runner and is out there in the elements right now. Good on you. Did we get you running before you stopped for the interview?
Hi, Natalie. Well, you know what? I was a little wimpy this morning. I did my run on the treadmill, but I'm here in beautiful Cleveland, really enjoying the snow today.
Well, it is good to have you on with us this morning. Being an avid runner, do you run in these conditions sometimes?
I do sometimes. I think it's more the ice that tends to keep me indoors, but you know, a beautiful snowy day like this with some clean snow on the road, something that I can really dig into when I run. It's a nice, crisp way for me to get my exercise in for the day.
How does running in the cold, if someone wants to do that or is considering doing, how does that affect our heart?
So it actually increases the demand on the heart, meaning that it increases our blood pressure, it increases our heart rate. Cold weather like this, icy, windy, anything that's a little bit of a stressor on your heart is really going to increase that demand for oxygen to help keep your body warm. And so what happens is, particularly in people who might have high blood pressure or who might have heart disease, it can cause symptoms and certainly be of a concern.
So in that sense then, on that same note, if someone does have underlying conditions, what precautions should they be taking? And should they just not do the outdoor aspect?
Yeah, so that's a great question. I mean, the first thing is to really get a sense of, are you symptomatic even on a given day in a warm climate in your usual environment? If you're actually having symptoms of heart disease or if you have uncontrolled high blood pressure, it's really a good time to get good control of those medical issues before you actually get out into very cold weather like this. If you're otherwise doing well, feeling great, the first precaution I would say is make sure you dress warm. If you're planning on doing a run or doing something that's exerting a bit more effort, a bit more intensity, it's okay to dress perhaps for maybe a temperature that's about 10 degrees warmer than what it truly is. And what I mean by temperature, really focus in on the feels like temperature. But if you're coming out for a walk, something of lower intensity, definitely dress warm because you're not actually going to be producing a lot of heat to warm up your body during that length of time.
So when would you say it's time to move indoors?
Well, it varies, right? Everything is relative. So if you're someone who's cool as a cucumber, loves the frigid outdoors, and you thrive in these environments, stay outdoors. But do understand that there's always an increased risk for things like frostbite. If you don't keep your hands nice and warm, your feet nice and snug, and some good old wool socks, you definitely want to take it indoors. For me personally, if I'm getting down into the single digits, or if it's a feels like temperature that's below 0, or if there's very gusty winds that are really just going to take the joy out of my run, I take it indoors.
I love it. And I mean, it looks so beautiful out there, so I could see how it would be wonderful to run in it. Do you have any advice for people who are just starting out and maybe wanting to consider running outdoors?
I would say don't let snow deter you. I mean, there's something about breathing some cool, fresh air on your run that really puts a smile on your face as you're running in the cold weather. You've got plenty of other people who are out there with you. Make a friend, wave hi to your fellow runner, your fellow walker. But it truly does bring joy. Just make sure you wear some warm gloves, warm socks, have a wonderful hat on board, and you'll be just fine.
I love it. Some great tips, wonderful advice, and you're inspiring me right now to get out and just enjoy nature. It can be beautiful in the winter, it really can. Thank you so much for being on with us this morning.
My pleasure.
Dr. Tamana Singh there. All right, so much good information on our Heart Health Show this hour. Dr. Mark is getting ready to take your questions. Keep sending them in. New Day at fox8.com. We'll get to as many as we possibly can a little later on in the hour. Also still ahead on our New Day Cleveland Love Your Heart show, blood pressure. What is it, why it is important, and how to lower it. Also, what alcohol and marijuana do to your heart. We're going to get into that when we come back. So it really seems the old saying is true. You are what you eat. And Cleveland Clinic dietitian Julia Zampano is joining us to tell us about the foods that can lower our blood pressure and our cholesterol. And I think people forget, first of all, thank you for coming in.
Thank you for having me.
I think we forget sometimes that just eating good food can be medicine.
Absolutely. Food is medicine. Absolutely. So we have a lot of great foods that can help lower cholesterol. I narrowed it down to 5 groups or categories.
Okay.
So we'll
Take us
start
through
with
them.
nuts or seeds. These specifically are pumpkin seeds, chia seeds, and ground flax seeds. Seeds are great sources of magnesium, and chia seeds and ground flax seeds are a good source of omega-3 fatty acids too. So those help.
So magnesium and omega-3 fatty acids, right? Both good for heart health. What do they do to help our heart health?
Sure. So magnesium can help widen those blood vessels, and omega-3 fatty acids can help lower inflammation, which is really key.
Important, right?
Yes.
Now berries. I know berries are great,
They're
high in
great.
antioxidants, but
Very high in antioxidants, also have specific antioxidants called anthocyanins, which really do also help aid in keeping those blood vessels as healthy as possible.
Now, I know people sometimes worry, like they see fruit and they think sugar. I know there's no added sugar in the fruit, but is it better to eat fruit certain times of day than others?
That's a great question. I'm never really concerned about the natural sugar in fruit. Specifically, berries are the lowest sugar fruits, so they're the ones, and they're the most packed in nutrition, so they're the ones that I tend to recommend most often. But if you are going to be eating fruit, I usually recommend trying to eat it more in the daylight hours, avoiding it in the evening, especially if you're going to be eating it after dinner and you've already had quite a few carbs.
Gotcha. Now this plate looks spectacular here.
Yeah, so this adds it all together, but the greens
let's go with
were
greens
the other
first. I'm sorry,
category.
yes.
Greens, so greens are great sources of potassium. So potassium actually helps your body get rid of extra sodium. It pulls fluid outside of your cells. So it really helps in a great way to manage blood pressure. A lot of great foods that have potassium. So a lot of fruits and vegetables, but leafy greens and nuts are also a great source of potassium as well.
Interesting. Okay.
And then lastly, fatty fish. So I have salmon here, but tuna or halibut, any oily or fatty fish has high omega-3, and the most absorbable form of omega-3 is in the fish. So you will help lower that blood pressure by lowering inflammation and getting that good omega-3 fatty acids.
I noticed that you also have beets on that plate.
Yes.
And they in themselves do the trick sometimes for certain things, right?
Beets are amazing. They're a source of natural nitrates, which our body converts into nitric oxide, which can help really widen those blood vessels, keep your arteries nice, wide, and open. So beets are phenomenal. I have them here. They're prepared with like a tahini orange sauce, which is phenomenal. And you can shred them and put them on a salad with some greens I have here, kale. So you can really, there's pumpkin seeds here. I made a chia seed pudding, which has cocoa powder. And cocoa powder is also very helpful because of the flavanols that really can help with blood pressure and overall just heart health.
I love it. I've started putting that into my smoothies in the mornings because of that, because of you. Thank you so much for coming. Thank you for
so
sharing
much.
all of that. David, we're going to continue the conversation here with food in our diet.
It sounds like a good idea to me because sometimes diet changes just aren't enough. So preventative cardiologist Dr. Luke Laffin can help with the next steps. Okay, we heard about some great dieting. How about, what's another way to do this?
Well, I mean, get exercise, losing weight, stopping smoking, all that's important. And then ultimately, some people need medicine.
And how does exercise come into play here?
Well, really getting your heart rate up, trying to get 150 minutes a week of moderate intensity physical activity is really important.
So when people need to lower their blood pressure, should they start with the diet or start with the exercise? Try to do both at the same time? What's a good approach that you can have success?
Yeah, so I really say to do both at the same time, really. Everyone wants to do it more naturally with diet and exercise, and that's really the base of the pyramid, okay? And then we build upon that with interventions like medications.
So there's some folks that go out there, maybe they can succeed a little bit with their diet or maybe with exercise, but then we need some other intervention.
Yeah, and importantly, medications don't work nearly as well if you're not doing some of those dietary interventions.
So what are ACE inhibitors?
So ACE inhibitors are a very common class of blood pressure medicine that's shown not only to reduce blood pressure, but also reduce one's risk of strokes and heart attacks.
Okay, so somebody starts doing this and they're starting to feel pretty good. Can you tell a difference when your blood pressure goes down? I mean, is it a difficult thing to identify just by feel?
No, most people have no idea if their blood pressure is very high. It's only really at the extremes, okay? If you're real high or real low, but most people, they won't know if their blood pressure is high or not.
I see something here. It's called angiotensin II receptor blockers, ARBs.
Yeah. So those are very similar, like a cousin to those ACE inhibitors you mentioned, okay? Very common, well-tolerated class of blood pressure medicines.
It seems like beta blockers, we've heard a lot about that over the years.
Yeah, they can be good in certain people with arrhythmias, history of heart attack, but sometimes they can have a little bit more side effects. So those other classes are really preferred for hypertension as first-line drugs.
How do diuretics come into play and help you?
So those are also a very effective class of blood pressure medicine, particularly if you're overdosing on sodium. So it gives you a little bit of a buffer to decrease that amount of sodium because you pee it out.
There you go. And calcium, does that play a part in this also?
That can. I mean, there's a real common class of blood pressure medicine called calcium channel blockers, which actually really just relax the blood vessels and are very well tolerated, good blood pressure lowering drugs.
So how does all this relate back to the heart health?
Yeah, so we know that controlling blood pressure reduces one's risk for strokes, heart attacks, heart failure, and kidney disease. And that's what it's all about, really.
So I'm thinking about like going down the road, and all of a sudden I get to this street or this crossroad, and I've got this problem where I got to fix my blood pressure, and I try different ways, and then I start taking the medicine, but then all of a sudden it's good. What happens if I stop? Can I stop?
Yeah, I mean, we always encourage to be on the lowest needed dose, right? So if someone has a lot of extra weight and they end up losing that, or they make big dietary changes, then we try and decrease medicines. Unfortunately, as we age, blood pressure goes up. So genetics and aging are working against us.
So I see some of these things can't be taken care of with just how you live or how you sleep or how you eat and that sort of thing. So you need some medical help, medicine help.
Exactly.
And then you get rid. So you're not going to be on this medicine forever then.
Not necessarily, right? That's why you got to see your doctor regularly and reassess, right? And if you're measuring your blood pressure, you want to not do it only in the office when you see your doc, but periodically at home as well.
So we talked a little bit about that, like doing your blood pressure at home.
Yeah.
Doing your blood pressure at home. You think there's an advantage to that versus doing it at the doctor's office? Because I know sometimes you go to the doctor's office and your blood pressure is crazy.
Yeah, exactly. Anyone that's on any type of blood pressure medicines should 100% be measuring their blood pressure outside the office, so at home.
And imagine once you get this together, you shouldn't go off the wagon, so to speak. Like you get your blood pressure under control. It's important to what other parts of your body.
Yeah, it's important for the kidneys and all of that as well, right? And so, you don't want to stop medicines cold turkey. You want to talk to your doctor and say, maybe I can decrease the dose by half and see how I do.
And we talk about all these different ways to treat yourself, make yourself feel better, but preventative medicine may be one of the best ways.
That's the most important thing, right? Start early, and then you don't have to worry about taking, 5, 6 medicines down the line.
Don't make a U-turn, go straight and do it right.
Right, exactly.
Great to see you. Thank you, sir.
Great.
Okay, folks, coming up on New Day Cleveland, Love Your Heart. That's right. What cardiologists want you to know about marijuana and alcohol.
Welcome back to our Love Your Heart show. Dr. Mark has some very important information about the effects of alcohol and marijuana on your heart. Here it is.
I think increasingly people are perhaps feeling more at ease around the use of marijuana now that it's been legalized in, I think it's 24 states and DC.
Dr. Christine Jealous is Vice Chair of Operations in the Heart, Vascular, and Thoracic Institute at Cleveland Clinic.
So perhaps they're not really considering the impact of marijuana use on their heart, and that can be marijuana that's smoked, e-cigarette, or ingestibles. So we need to really get the message out that at this point, although it may be legal for recreational use, there are still some significant cardiovascular effects that we worry about.
Marijuana can increase the risk of heart attack by 25% and the stroke risk by more than 40%. Your lungs can also be affected.
And that's over and above the baseline risk that people have from things like smoking, diabetes, or just generally getting older. So it's not an insignificant risk. Of course, as a physician, I'm not endorsing the use of marijuana, but I think given its status now as legal for recreational purposes, it's important that we get that message out and encourage people to discuss it with their own physicians.
Alcohol can also have some negative effects on the heart.
I think from the perspective of alcohol, everything in moderation, of course. We worry about chronic alcohol use precipitating things like a cardiomyopathy, which is where the pumping function of the heart can get reduced. Alcohol can also contribute to other things like palpitations and arrhythmias, along with effects on many other organ systems like the liver and the brain and the gastrointestinal system. So it's something that people need to be aware of. In small amounts, we're typically not so concerned about the risk of those major cardiovascular complications, but certainly in larger amounts, heavy drinkers, folks who have alcoholism as a chronic disease are certainly a much higher risk for those types of complications.
Heavy drinking is more than 8 drinks per week for women and up to 15 drinks per week for men. Binge drinking is 4 to 5 drinks during a 2-hour period.
I would say to my patients, never be embarrassed. Our conversations are completely confidential, and it's much better that I know the truth of the situation so that we can have an honest, transparent conversation about what choices they're going to make. And I'm going to support them in whatever way I can, but part of my role is about education and helping them make the right choices. I would much rather be proactive and preventative in my approach with young people than seeing them 20 years from now when they've got cardiovascular disease that we could have prevented.
Great information there. Still to come, Dr. Mark answering your questions. We have some good ones. We'll be right back with those.
Sponsors of New Day Cleveland include.
Welcome back. We have your questions. Dr. Mark is going to get to the answers. We'll jump right into these so we can get to as many as possible. So Christina wrote in. She's a 68-year-old woman. She takes a statin for high cholesterol and medication for high blood pressure as well. Her question is about coronary calcium scores. What does it mean? What do you do if your score is high?
The coronary calcium score is a CT scan or a CAT scan, so very, very quick, like an advanced x-ray, and it detects whether or not you have calcium in the arteries of your heart. calcium being plaque, basically. And if you do have calcium in the arteries of your heart, that means you do have some blockages, and being on a statin and something to control blood pressure as necessary is the right thing to do, but the statin being key.
Okay, this question is it dangerous if I miss a dose of my heart meds here and there? So here and there changes it up a bit.
Yeah. Better, of course, not to miss a dose, but let's say you're on a statin or a blood pressure medicine and you miss a dose, it's okay. Just take tomorrow's dose. You don't have to double up or make up for it. But I was saying this to someone earlier, just put that medicine next to your toothbrush. Did you ever forget to brush your teeth in the morning?
Right.
No, you don't. So there's the toothbrush, there's my statin or blood pressure medicine. Just do them all at once and you're good to go.
So don't double up.
Do not double up. Don't try to make it up.
Okay.
Just take it the next day.
We had another viewer ask this, but we had a lot of questions about this one, actually. How do I know if it's a panic attack or a heart attack, especially if I get panic attacks often?
Panic attacks will subside. So let's say you're having a panic attack, you feel your heart racing and you're even getting some chest pain. If you can make that get better with some slow, deep breathing, then it's not a heart attack. On the other hand, if you have these symptoms with chest pain and they do not go away, or if it's fundamentally different from your normal symptoms, could be a heart attack. Always, always, always better to be on the side of extra caution. It's way better to call an ambulance, find out nothing was wrong, than to not call an ambulance, have a giant heart attack, and wind up in big trouble.
To be over crazy about that, though, and freak out about it just makes it worse and worse.
Yeah, absolutely.
Okay, let's see, what's a good one?
Marilyn here.
This is a wild one. Marilyn asked, if I have numb hands at night when I sleep, does that have anything to do with my heart?
Nothing to do with your heart, almost certainly has something to do with your sleeping position, because that's compression of nerves. You know, that tingly feeling like your foot went to sleep. If you get that in your hands or feet or legs when you're waking up, probably your sleeping position, try a different position. If it doesn't get better, see your doctor, because you could have nerve compression somewhere at spinal cord level.
Lisa wrote in saying that I recently had influenza A and I felt like my heart was racing. Can the flu bring on heart symptoms like palpitations?
100% yes. Lisa has identified something that happens to a lot of people. You can get abnormal heart rhythms, atrial fibrillation. If you already have heart disease or heart disease risk factors, the flu can make them worse.
This is a wild one. I don't know. This is from Beth. I had broken heart syndrome in 2014, and after that I was diagnosed HCM. Did broken heart cause this, or did I have it all along?
Broken heart did not cause that. HCM, or hypertrophic cardiomyopathy, is an inherited condition in which the heart muscle becomes overly thick, so thick that the heart muscle doesn't work well. That's a separate thing, completely treatable, even with medications now. Broken heart syndrome is a different thing entirely, in which a sudden emotional trauma, which can be as innocuous as a surprise birthday party, causes a release of hormones that disturb the heart function, and that gets better.
That was a great question.
It is.
Yeah.
We have just time for one more quick answer from you. Can a diagnosis of pulmonary hypertension lead back to an undiagnosed heart problem? That's from Joan.
Yes, pulmonary hypertension is not your normal high blood pressure. That means high blood pressure in the lungs, and that can be just a problem with the lungs, but it can also be a problem with a heart valve. So if you have pulmonary hypertension, next step, get an echocardiogram.
You know, I love it. Every time we do this show, it's like, you know, we've done so many years in a row. It's always something new, and something keeps, you know, giving us more information on how to keep ourselves heart healthy.
Those were great questions.
You're innovators there at the Cleveland Clinic. We're so blessed to have you. And again, that's why we always have something new, because you're always on top of things. Thank you for all of your answers. Thank you for coming in today. Thank you to everyone, all of our experts on the show today. We learned a lot.
And thank you for what you do.
My pleasure.
Always.
Stay heart healthy.
Stay heart healthy. There you go. Thank you for joining us for our Love Your Heart show.
So long.